In December 1971, doctors and journalists who want to assist populations in distress across the world come together and create Médecins Sans Frontières. For the past 50 years, the organisation has constantly strived to reinvent the concept of humanitarian medical aid, providing assistance to populations affected by conflict or forced to flee. Since its inception, MSF has been driven by an ongoing commitment to ensure people excluded from healthcare are able to benefit from innovations in medicine. Late 1979. For the first time, MSF assumes sole responsibility for the health of refugees in Thai camps Sakeo and Khao Ideri. In 3 months, the camp's populations increased from 30,000 refugees to 300,000. Young pharmacist Jacques Pinel discovers piles of boxes hidden under tarpaulins in tents and doctors coming to get drugs as they need them. This is the camp's pharmacy.
Un bistouri, des aiguilles, du nitrosol. Excellent. Ça j'avais demandé. Métronidazole.
He decides to take charge and organises systems for storing drugs according to their generic names, management supplies and orders, etc.
Je m'étais rendu compte dans ce camp de Sakeo là, que c'était un gigantesque foutoir, quoi. Il y avait un problème d'organisation, quoi. Il y avait des médecins, il y avait des infirmières, peut-être pas assez, mais c'était surtout l'organisation qui semblait déficiente, quoi.
By addressing MSF's organisational issues, Jacques Pinel takes the organisation to a new level. The creation of MSF Logistics ensures the field is supplied with drugs. As MSF progresses with its provision of medical aid, it has no reliable tool for studying epidemics. Between 1986 and 1987, Epicenter is set up to provide epidemiological expertise. In 1990, an emergency forges Epicenter's role. A Malaria epidemic in Mozambican refugee camps in Malawi.
Toda essa gente que apresenta bacalhau tem que ir a visitar la consulta esse dia.
Il y a de plus en plus de gens atteints de pélagre qui viennent nous voir. C'est une maladie dangereuse, même si les premiers symptômes ne sont pas mortels.
A first outbreak affects around 1,000 refugees, and the second, 20,000. By introducing a surveillance system, checking registers, calculating the composition of food rations, and conducting surveys in the camp, the Epicenter team are able to demonstrate vitamin PP deficiency is a risk factor, a deficiency caused by the food aid distributions which don't include groundnuts.
Dans 5 ans de réfugiés, une épidémie de cette ampleur, il n'aura pas existé. C'est pas normal. Ça montre l'incompétence des organisations responsables pour l'aide humanitaire à ces réfugiés de remplir les rôles pour lesquels ils sont créés.
With MSF Logistics and Epicenter, MSF now has the tools to extend its emergency capabilities. The two entities also enable the association to address many other areas: vaccination, access to primary healthcare, and mother and child health. At the start of the 1990s, the Soviet Union's health system collapses, but tuberculosis resists. This contagious disease is one of the leading causes of mortality in the world, and its spread is facilitated by poor living conditions. But it thrives principally due to the lack of interest of medical research. In the 1990s, diagnostic tools date back to the beginning of the 20th century, and the most recent treatment molecule to the early 1960s. One course of treatment takes several months and causes quite severe side effects. So many patients stop taking it. Treatments for resistant forms are even longer and more grueling, as many drugs are ineffective and their side effects even more severe. Only half of patients recover.
Ce qu'on appelle la tuberculose multirésistante, c'est-à-dire un bacille qui n'est plus sensible aux antituberculeux utilisés habituellement des patients pour lesquels on n'a pas de thérapeutique vraiment efficace à proposer.
MSF is a powerless witness to the non-existence of appropriate drugs, and its teams don't have the tools for treating other illnesses that primarily affect people in hardship. In 1996, MSF organises a medical symposium to better understand the problems encountered in the field. The conclusion is crystal clear. Most of the therapeutic arsenal is composed of drugs either ineffective or too expensive. And for some diseases, there are no drugs.
Why are we, a medical humanitarian agency, here in Seattle at the start of the ministerial meeting on trade? Because our patients are dying. Our patients are dying not because their diseases are incurable, but because as consumers, they do not provide a viable market for pharmaceutical products. After all, products don't have rights, people do. Your political leadership is vital to their survival. Thank you.
The extreme inequality is laid open. 90% of the world's medical research serves 10% of the population, and most often its purpose is to file new patents for drugs very similar to already existing ones used to treat financially viable diseases with high earning potential. So, 90% of the world's population falling victim to deadly diseases like malaria and trypanosomiasis are forgotten.
Today, in a globalizing market economy, a growing injustice confronts us. More than 90% of all death and suffering from infectious diseases occurs in the developing world. Some of the reasons that people die is that life-saving essential medicines are either too expensive, are not available because they're not seen as financially viable, or because there's virtually no new research and development. This market failure is our next challenge.
The Nobel Peace Prize money is invested in a new entity, the Access Campaign. Also known as the Campaign for Access to Essential Medicines, its purpose is to improve access to drugs for people in resource-poor countries. 5 years later, along with many of its international partners, MSF creates the DNDi. Dedicated to research into neglected diseases, the DNDi has several objectives: strengthen research, relaunch production, campaign on patents, pricing, and access to drugs. With its Access Campaign and the DNDi, MSF engages in public advocacy to mobilize the support of doctors, pharmacists, researchers, legal advisors, economists, and health activists to achieve one of its principal goals: to make health accessible to all. In the late 1990s and early 2000s, health workers are helpless in the face of countless malaria epidemics in Africa. It's a therapeutic impasse, as the malaria parasite has become resistant to old molecules that have no effect on 30 to 50% of patients. But ACT, a new treatment derived from artemisinin, has for several years been approved for use in Asia after prolonged scientific endeavours and advocacy. End of 2001, a malaria epidemic sweeps across Burundi.
Donc on peut estimer que la situation est très grave actuellement, particulièrement chez les enfants de moins de 5 ans.
Opinions at MSF differ between those who think that these new treatments with proven efficacy should be administered whatever the cost, and those that the organisation should wait for changes in national protocols. Meanwhile, an MSF doctor in the field has started prescribing the new treatment.
Il a été sous perfusion? Oui. Combien de jours on l'a mis sous perfusion?
Even though she's not authorised to do so, neither by Burundi's authorities nor WHO protocols, the Minister of Health decides to expel MSF's head of mission. The efforts of the organisation's leaders to explain the situation convince Burundi's president, who finally authorises the treatment. This episode acts as a catalyst for a change in malaria treatment protocols in African countries. MSF's advocacy results in tangible progress to the benefit of patients. In the late 1980s, a deadly disease emerges, AIDS, caused by the HIV virus, and its cohort of opportunistic diseases decimate entire populations.
People with AIDS are supposed to die anytime. There's nothing which can be done for them.
After years of research, Western countries develop antiretroviral ARV drugs. Hospitals are emptied of patients and fewer people die, but they aren't available to global South countries. Why are their patients deprived of these drugs? The excuses are as many as they are dubious. Cost, lack of infrastructure, lack of confidence in patients who, by not taking their medication regularly, risk developing a resistant form of the virus.
We heard from the radios that there is a medicine for that disease. That's true.
Why is it that the drug itself is very expensive, since it is likely to save the lives of many people?
Maybe those who have got money, they can manage to buy them. For those who have got no money, they'll die.
En étant une organisation médicale, on se doit de soigner les gens. Donc il y a des médicaments disponibles, ils sont chers, ils sont normalement pas accessibles à cette population parce qu'ils sont trop chers, mais c'est un droit, le droit aux soins. Donc on peut introduire des ARV au Malawi dans les conditions qu'on est pour pouvoir les soigner.
Patents are a major barrier in access to drugs. In 2001, during negotiations with the World Trade Organization, the rules on pharmaceutical product property rights are discussed. MSF and other organizations consider they should not be treated like other commodities. The pressure from MSF and its allies eventually pays off. Differential pricing according to the country is implemented, which makes treatments more accessible to patients in low-resource countries.
En 2000, le prix de cette thérapie coûtait entre 10 000 et 12 000 euros par an et par patient. Aujourd'hui, grâce à la concurrence effectuée par les groupes génériques, ce même traitement, avec la même efficacité, coûte 200 euros par patient et par an.
Those breakthroughs enable MSF to introduce antiretrovirals, the new life-saving drugs for HIV-positive patients, into its programs. But in countries lacking health facilities and personnel, adapting protocols also ensures as many people as possible have access to treatment.
We wanted to task shift some of the responsibilities to less medically trained people.
How many people are supposed to come to the clinic?
2.
I have 2 only.
people from the support group. These are patients. These are people who have been on ARVs for quite some time. That's why at some point they are also called expert patients. They are the people who know what it means to be on ARVs, to be on treatment. So they were identified to dispense ARVs. They managed very well, and they are so proud to be doing that at the meantime.
Simplifying treatment involving patients and patient associations who even dispense the drugs, reducing clinical follow-up, enhance access to treatments in the field. In 2005, Niger. MSF is witness to an exceptionally severe nutrition crisis. Victims of malnutrition or opportunist diseases, as usual under 5-year-old children, pay the heaviest price. 'New tools and therapeutic approaches recently developed by MSF, other organisations and scientists revolutionised the treatment of child malnutrition. Until now, children spent several weeks hospitalised in nutrition centres, which required their families and medical staff. But the introduction of new ready-to-use therapeutic foods like peanut-based Plumpy Nut children like the taste of is a game-changer. Families go home with rations, leaving health centres to focus on the most seriously ill children needing inpatient care. Access to these foods also prevents the most acute forms of malnutrition.
Si l'enfant mange et qu'il n'a pas de pathologie associée, ça va nous permettre de le traiter en ambulatoire. Et donc il va pouvoir rentrer à la maison avec sa maman avec une ration en aliments thérapeutiques et on va le suivre de semaine en semaine.
Medical research which has produced these ready-to-use foods, modifying protocols and decreasing the need to convalesce in nutrition centres make it easier to manage food crises and reduce mortality. In early 2014, an Ebola epidemic rages through West Africa. This hemorrhagic fever is deadly and there is no vaccine or drug to treat it. It's the biggest epidemic since the discovery of the virus in 1976. Within the MSF movement, operational approaches vary. Some sections open treatment centres, while others, considering they're insufficiently equipped, decide not to intervene.
J'ai eu peur d'envoyer des collègues d'une façon émancipée en Afrique de l'Ouest. Donc j'ai eu peur, j'étais pas le seul, certains directeurs aussi ont eu peur.
28 of MSF's national medical staff are infected and 14 die. Among the first organisations to intervene, MSF opens treatment centres and confronts the limits of science. Whereas its teams are used to treating their patients, often all they can do is isolate them and alleviate their symptoms, organise funerals and protect themselves.
It was horrible on the first day of work. When I got to work that morning, on that day we have something like close to 20 deaths, and 6 of them died in my arm while carrying on nursing care. It was horrible.
Thrown into disarray, the MSF teams are in a paradox as they tell the sick to come to overwhelmed centres where patients are dying in considerable numbers.
It is really an extremely challenging situation for everyone. And MSF, we can't do more than we're doing now. We've opened this center a week ago. It's completely full today. We are desperately trying to get more beds. We have bulldozers and rope holes getting up. We're recruiting staff, we're training staff, but we would like to do much more, but our first priority needs to be the security and safety of our staff.
In a speech to the United Nations, MSF appeals for international
action. Many of the
action.
member states represented here today have invested heavily in biological threat response. You have a political and humanitarian responsibility to immediately utilize these capabilities in Ebola-affected countries.
With a surgical gown, it's not as watertight as a relative...
MSF shares its expertise with other NGOs and, thanks to their intervention, the response to the epidemic is scaled up.
We don't want our housemates or our patients.
Médecins Sans Frontières est la seule organisation à avoir l'expertise de prendre en charge des cas d'Ebola. Et cette expertise, on voudrait la partager aux autres maintenant, afin qu'eux puissent se jeter dans la bataille avec nous.
In late 2014, there's hope of a vaccine in Guinea. MSF participates in the clinical trials.
These vaccines show an efficacy around 100%. This is the first time in the history of the disease that we demonstrate an efficacy of a preventive tools as a vaccine. We probably need to include this new evidence, these new tools, to the normal component of the intervention.
When Ebola breaks out again in 2018 in East Democratic Republic of Congo, MSF benefits from the expertise acquired during the first crisis. However, its teams are working in a volatile, war-torn region. Congo's National Biomedical Research Institute develops a new treatment which, with 2 new vaccines, offers promising perspectives for treating the disease.
On pense que ça va jouer un rôle important au niveau du contrôle de l'évolution de l'épidémie parce qu'on va protéger directement ce qu'on appelle les personnes en première ligne, les médecins, les infirmiers, les hygiénistes, mais aussi les ambulanciers.
C'est nous qui sommes en contact direct avec les malades tout le temps. Donc, c'est nécessaire de venir prendre le vaccin quand même.
In 2020, a pandemic kills millions of people, disrupts businesses and economies across the world, and puts huge strain on health systems.
India has just seen a surge of cases beyond anyone's imagination.
COVID-19 is a sharp reminder to the world of the devastating impact of infectious diseases. To continue its routine activities, protecting medical workers and patients becomes MSF's priority. The association also rolls out emergency programs to help treat patients in Brazil, India, Yemen, and the Democratic Republic of Congo. In other European countries and the US, MSF focuses its efforts on vulnerable people excluded from health systems.
L'accès au système de santé est quand même très dégradé dans cette période d'épidémie. On considère que la précarité est un facteur de vulnérabilité. Et puis ensuite, pour certains d'entre eux, ils ont des comorbidités, donc des pathologies chroniques qui peuvent les rendre plus vulnérables à des formes plus graves de la maladie.
Tu peux le mettre.
Bringing lasting change to treatment protocols and social attitudes to infectious diseases, the pandemic is shifting the challenges of global health. MSF drives innovation in diagnostic tools and 3D prosthetics. In its missions, the organisation develops specialist activities like reconstructive surgery, which is rare in emergency settings. It also opens up new areas, new battles for access to treatment. The organisation launches cervical cancer programs in Malawi and breast cancer programs in Mali to give women with no hope a chance of survival. In Paris, 95% of women with breast cancer survive. In Bamako, 95% die. During the 50 years since its inception, MSF has gained legitimacy from its contact with its patients. As a healthcare organisation and by becoming a driving force for innovation, it campaigns for access to health for everyone. What will be the face of humanitarian medicine tomorrow, and the role of new technologies in diagnosis and treatment? As inequalities in access increase and affect more categories of people, biomedical research undergoes a revolution. What new medical battles await MSF?